So you might have heard the news a couple weeks ago that Planned Parenthood of Wisconsin has paused abortions amid federal Medicaid funding cuts. So it was announced a couple weeks ago at the end of September that they would Planned Parenthood of Wisconsin had stopped scheduling any sort of abortion services in order to protect and be able to continue to serve all of the other medical services that they provide to people. And so what popped up for me was maybe a dumb question, because I don't know why I didn't know the answer to this. But as far as like the who, what, and where and why you can have access to abortion in Wisconsin and across the state, and why it's something that a OB-GYN that you like delivers your baby can't provide. So who did I ask? My friend, Dr. Kristin Lyerly, who is an OB-GYN, and you might have heard that name when she was running for Congress last cycle in Wisconsin's 8th Congressional District. But she joins us now to kind of just answer some of the history of access to abortion care, and also maybe explain a little bit of where we are right now with the Planned Parenthood lawsuit and access there. So welcome to the show, Dr. Lyerly.
Well, thank you, Kristen Bry. And we all miss Steve, but how often do you get a Kristen combo?
That's true, especially spelled the right way.
Right?
With the double I. It's the only way, it's the only symmetrically, aesthetically appealing way to spell Kristen is Kristin, not E-N.
That's right.
I don't know who
we'll fight you for
that
it
was
too.
The default, but doesn't look as good. All right, Dr. Lyerly. So I guess before we get into kind of the history lesson, where are we right now? Kind of explain what the legal fight of this is, but also what the One Big Beautiful Bill did to Planned Parenthood.
Okay, first, I want to acknowledge that it has been really hard to know what you can access, what kind of care you can provide, just because the landscape has changed so much. For many years, over a decade, it was little thing after little thing that was just picking away at our ability to access and provide care. And then it was this roller coaster with the 1849 law, and what could we do and what couldn't we do? And then it was back, and now Planned Parenthood is putting it on pause. Like, what, as a person, what can you do? And as a doctor, what can I do? So here's the answer. Abortion is legal in Wisconsin up until 20 weeks post-fertilization age. That's how the law is written. That is, by the way, not a medical term, which is weird. Our laws should be written in medical terms with data and evidence, and that is a very political term. So, setting that aside, Planned Parenthood has decided to pause abortion care in the 3 clinics where they offered abortion services: Sheboygan, Madison, and Milwaukee. And that's because the Trump administration had put into the Big Beautiful Bill this provision that was intentionally planned to defund Planned Parenthood. Planned Parenthood only provides about 4% of their services are abortion services. The rest of it is family planning, it's STI screening for sexually transmitted infections, it's contraception, it's cancer screening, it's preventive care, so much other stuff. But the way that the bill was written would take down Planned Parenthood clinics all across the country. So Wisconsin was the first state to say, we don't know exactly what this means for us legally, and we don't want our patients who need all of these other services, and there are so many people who rely on these other services. They can't get it elsewhere. They can't afford it elsewhere because Planned Parenthood offers it on a sliding scale. So they make it affordable. And if these people can't get it there, it's not like they can just, walk into some other doctor's office. They can't afford it. So this is the sacrifice that they've made. The hope is that it's temporary. We honestly don't know what the forecast is for the future. The good news is, though, when it comes to abortion care, that there are 2 clinics still in Milwaukee, Care for All and Affiliated. Both are excellent. Care for All is brand new. Affiliated has been there for a long time. Both are there. They're fully running. They're busy. They're patient focused. And if you can get yourself to Milwaukee, you can get the services that you need.
So that's what's kind of crazy about this is like there was all these legal battles in Wisconsin to basically go back to what the laws were on the book pre-Dobbs. But so now it is legally available. It's just not actually accessible for many because of the bottleneck on who actually provides abortion services. And so this was the question I had for you, because I'm in the case of the life of the mother, let's say, when it's a planned pregnancy, it's a wanted pregnancy, and we hear these terrible stories of things that happen into the 2nd trimester, even into the 3rd trimester. And in those cases, it is technically an abortion when it is like a woman's going to go septic. There's a miscarriage, all these different things that can happen. And in those cases, it's still called an abortion, and it happens in a hospital setting, right?
Yes.
And so where is this line that in hospitals or in treatment that they do not provide, under my understanding, like first trimester abortions, but then they can in the case of emergency? Like, where is the rules as far as who actually can provide abortion services and when?
I'm going to tell you how it is.
Okay.
And I'm going to tell you that this has just kind of been a culture thing that has developed over the years since Roe. So when Roe happened, a lot of hospital systems, a lot of physicians didn't want the specter of abortion hanging over them. They didn't want the protesters. They didn't want the ugliness. They didn't want to have to deal with that. So what ended up happening was we developed abortion clinics like Planned Parenthood, like Care for All, like Affiliated, because regular doctors just didn't want that to be, and not just doctors, but doctors in hospital systems didn't want that to be part of what they provided. As a result of that, over time, it kind of just became baked in, and we just got used to it. So now, in general, anywhere in the state, if you go to seek abortion care, for the most part, especially first trimester abortion care, like what you typically think of as an abortion, you will often be sent to an abortion clinic. One of the biggest problems is that now more doctors are understanding, younger doctors who are coming up in this environment, and they're understanding how important it is to advocate for our patients and to provide these kinds of services. We want to do this. But because most of us are now employed, it's now the hospital systems that are saying no. It's the hospital systems that don't want to deal with it. So, I mean, I'll share a personal example. When I started my own practice, or when I joined a practice up here in Northeast Wisconsin back in 2013, there was a protester who would walk outside in front of the place where there was an abortion clinic, and the hospital very much wanted that to disappear. So they made a decision not to allow the new doctors to provide that kind of standard abortion care. And even though my partners and I wanted to do it, the hospital system said no. We could still provide those life-saving abortions, but we had to jump through a bunch of hoops in order to do it. 24-hour waiting period, all of these things, unless it was an emergency. And it was a lot of rigmarole where we had to do a lot of paperwork in order to provide the care that our patients needed. And that's not healthcare. That is not how it's supposed to be. When you show up to see your doctor and you have a need, you should be able to get the diagnostic testing, all of the options that you need, and you should be able to pick out your own treatment. And it should be able to be provided by your doctor in your hospital system. But that is not how our culture has evolved. But the bright side is we are getting back to that. Doctors are wanting to do that. The American College of Obstetricians and Gynecologists, my professional organization, has recently written a very strongly worded statement saying that hospitals and hospital systems need to provide doctors the autonomy to be able to provide this kind of patient care. So I think we're moving back in that direction, but it's not going to be fast. It's going to be a long, slow process.
Well, and it's interesting because I would say in the political environment, it's hard for me to imagine that happening very fast. But we're talking to Dr. Kristin Lyerly. When we come back, we're going to move on from this topic and talk a little bit more about the medical community, whether it's the CDC or different associations, and how they are adapting under this administration with sometimes conflicting directives. Is that a fair way to put it? Sure. You are now back to practicing. You have a lot of plates that you juggle, but you sit on a lot of different boards as well, as far as in the medical community. And so, we saw this week that there's lots of turmoil going on in the CDC in general, but the newest one is the fact that there was layoffs, and then some people weren't supposed to get laid off, and so they're coming back. It feels like there's obviously every week there's conversations around Tylenol's impact on autism and just some of the talking points coming about science. And I wanted to get your input, at least personal anecdotes of how people in your community, your peers, are adapting with whether it's RFK or the administration, because it just feels like very unstable ground right now.
It is really unstable ground. And just like with abortion, there's so much confusion because it's so chaotic. J.D. Vance was acknowledging this over the weekend in the many interviews that he did, that, yeah, we fired people and we're not always going to get it right. And we're bringing people back and there's going to be chaos. There doesn't need to be chaos. And in this setting, there shouldn't be chaos. There should be expertise. There should be knowledge. There should be evidence, but there shouldn't be chaos. You know, with regards to the CDC, they publish information that doctors like me, doctors all over the country, use every single day as we're taking care of our patients. It's the MMWR, the Morbidity and Mortality Weekly Report. They tell us what is popping up. Where are the measles cases? How do we treat them? Where is the drug-resistant gonorrhea? Things that you don't even want to think about, but we need to know. But now what's happened is the CDC has fired that entire team. So doctors
Wait, is that
on the
team
ground.
that got fired, or is that the team that got brought back?
Hey, did they get brought back?
I thought that was the team that got back because of the importance of that report.
Maybe they did. I haven't seen that news, but they
Okay.
definitely got fired in that first 9 p.m. holiday weekend big firing spree that they went on. But, you know, it's not just them. It's all of the people who are out in the field doing the epidemiological work, who are investigating the food outbreaks, the measles outbreaks, all of those things that they then sequester and keep in Texas or Minnesota or Pennsylvania so that it doesn't spread all over the place. This is a ton of work. And those folks now are not there. They don't have the pathway to get that information back to us, to Congress, where it needs to go. So doctors like me are just trying to get through the day. We're busy. We have a lot of patients. We don't have time to deal with all of the political stuff. That's why you don't see doctors on TV that often talking about this kind of stuff, because we're not trained, we're uncomfortable, and we're really focused on patient care. But I do this because we have to, physicians have to talk about what's really happening. I mean, I think Susan Menares is a great example of this. She's the CDC director who is a Trump supporter, who was elevated by RFK Jr. and then subsequently fired a month later when she refused to rubber stamp the vaccine recommendations without actually reviewing them, when she refused to just fire people because he told her to. She has experience. She is there for a reason. And even though she's a Trump supporter and an RFK friendly person, she felt an obligation to medicine, and she lost her job as a result of it. We have completely lost our bearings in this country when it comes to the NIH, the CDC. Everything under HHS is entirely politicized right now. And it's so difficult for us as doctors and patients to trust the information that we're seeing coming from them.
And so because I think there's a certain extent that, like, all right, this is one administration. And so is there thoughts that, like, all right, with the next administration, maybe it will go back to normal, and you just kind of like keep your head down and take care of your patients and like ride out the storm? Or I guess it's more of that, of like, how do you, because so many people tune out like, say you have a job where you can just tune out the news, focus on your job, you keep going. But it just feels like your guys' job is inextricably linked to some of the decisions that are being made at the federal, national level. That how do you insulate yourself and continue to provide the best care that you can in the times that we're in?
Just like everybody else, you put your head down and you get your work done.
Okay.
And you just wait for a better day and you hope it's coming. We don't have enough doctors. We don't have enough nurses, and we're not training enough people to fill the deficit and the future need. Remember, the baby boomers are coming, and the baby boomers are huge healthcare consumers. And they're living in rural areas where we're losing rural hospitals. The Trump administration's big, beautiful bill cut rural healthcare funding by 2/3. They say $500 billion. What they actually did was take away a lot of money. So rural hospitals are living on the brink. People who live in rural communities are struggling to get access, and doctors are not practicing in those communities. What is on the horizon is a very, very unsettling future for all of us. And I can see it. My colleagues can see it. People who are really paying attention can see it, but I think the average person can't. And that's really distressing.
All right. Take a breath. Anything? Let's end on a positive note. Anything positive happening right now that you'd like to give a quick shout out for before I let you go?
Yeah, people are fighting back. We're all fighting back. I mean, No Kings is this weekend. So many of my colleagues we have doubled the number of people at the Committee to Protect Healthcare, which is a patient-facing advocacy organization where I chair the board. We have over 40,000 doctors all across the country doing this work, using our voices in the places where we need to be using our voices. And since last November, our numbers have doubled. So doctors are stepping up, nurses are stepping up, patients are stepping up. Our stories are compelling. They're so incredibly important, and we can't stop using them. This is how we get out of this. This is where our hope lives, Kristin.
All right. Dr. Kristin Lyerly, thank you for your time today, and we'll talk to you later.
Yes, you will. Thank you, my friend.